fear rages and panic spreads. Fueled by chaos and confusion, the virus known as COVID-19 has caused a global pandemic and an uncertain future.
85% of the deaths that have occurred could have been avoided. What made the difference? Early treatment.
If the government can coerce you to engage in an unwanted medical procedure, what rights do you really have?
The only one with the power, legally, is the patient and the patient's family.
It's freedom, not feardom. So I've always known, I said this is a medical issue, but it's a constitutional crisis.
We need to stand up and actually stand against this tyranny. They're trying to destroy your liberties one at a time and all of your freedoms.
We know for a fact that these injections cause actual tissue damage to the heart. Without truth in medicine, without truth in science, you don't have science, you don't have medicine. All you have is an agenda.
Well, since the outbreak of COVID, many have been searching for answers, often only finding more questions. But with more expert and scientific voices rising to share the truth, hope is breaking the grip of fear and uncertainty. Well, today, we'll be looking at the many questions that you've all sent in from around the world. We hope to give you some answers. We're back at the table with our special guests, Dr. Peter McCullough, Dr. Simone Gold, and Dr. Richard Bartlett. Are you ladies ready for your questions?
Oh, I'm ready. I want to go if that's okay.
Okay.
So I already, you know, my husband and I love him, love you, babe. But we have this conversation like, but how could every single news outlet be saying the exact same thing, Kendra, and only Daystar be saying something different? How is that possible?
So what's your husband's name?
Dusty.
Dusty. But he's very handsome and wise.
Dusty,
so yes,
I want to
continue.
tell you to Google or internet search something called the Trusted News Initiative. The Trusted News Initiative is right out of George Orwell's 1984. And this is where all the media got together and said what they could and could not print. Who's in the Trusted News Initiative? Well, there's New York Times, the Washington Post, the Associated Press, Twitter, Facebook. They've all agreed in December 2020 not to allow any information out that disagreed with the narrative. How do you like that? And that's why the censorship. Then there's also the propaganda. Where does the propaganda come from? How come you look on Facebook, you look on Twitter, and you see the same message everywhere? Yeah. Well, if you go back to the budget that Joe Biden signed, February 2021, in that budget is $1 billion allocation, $1 billion with a B, allocation for advertising of the vaccine all across all platforms, Facebook, Twitter, YouTube, influencers. It's actually in the federal budget. There's never been a number like that allocated to such a thing. $1 billion in the federal budget for propaganda, Trusted News Initiative for censorship.
Wow. So how in the world have you seen, I know, the videos where all the news agencies, the anchors from every state are saying exactly the same thing.
Same sentences.
So can I say one more thing? So my father is a doctor, and my father warned me when, a long time ago, I think in the 80s, when they allowed pharmaceutical advertising on television, my father said to me then, this was going to be the death of medicine. Everything changed really after that. So if when you watch a program and you see the anchors kind of saying the same thing, then notice the advertisers. About 60% of advertisement on television are pharmaceutical ads. So they're answering to their bosses.
Yeah. Wow. The only thing about those ads, though, is when it's all beautiful, you know, they're running through the grass.
It's always the same ad, actually.
Their hair's flowing, and they tell you how great it's going to help you with whatever symptom, and it said, may cause heart attacks, you know.
Fast. Well, that's fair balance. That's the point. So we have multiple laws that demand that any medical product, a biologic product, a vaccine, a drug, is presented in fair balance. There's always risks and benefits to everything, and you'll see that on TV. So when the President of the United States gets up and says, get vaccinated, he's violating law. Yeah. Law says that everything must get vaccinated, but you could die of myocarditis. There has to be some fair balance, and there's been no fair balance in the advertising of the vaccines.
So who's going to sue him? Dr. Gold, you're a lawyer. I mean,
I've got my hands full. She's already suing the government over here for a lot of things going on. But what is your question from our viewer, Rachel?
So I actually am curious about this because we know that the monoclonal antibody infusions have been successful if you get them early enough. So getting them early enough is key. So why all of a sudden are they stopping those?
Well,
where did they go?
Oh my goodness.
Did they disappear?
I was texted on a Friday asking if I would start a monoclonal antibody infusion center, be a part of that on Monday.
3 days later. And so on Monday, I was dressed like a walking marshmallow in the universal precautions for 11-hour days, 6 days a week in West Texas. And we infused roughly 1,000 people in 3 weeks' time. Wow. It was amazing. People had their headaches go away after 5 days. I heard this over and over. The chest pain went away. The shortness of breath went away. The fatigue lifted. And so I heard this over and over. And this was when we had Regeneron, a brand, which is what President Trump got, which is what Dr. Ben Carson told me that's what he received. And he was recovered in 5 days.
Alan West.
Alan West. Yeah. And so it was a game changer. The statistics were it decreased the chance of dying or hospitalization by 81%. 81%. I like 100%, but 81% is good. Right. And it was a tool. In 30 minutes, many people had a game changer in 30 minutes while they were sitting bored in a chair. But early treatment did make a difference, and we had no shortage until this guy named Joe decided he was going to take charge of the distribution of Regeneron. Would
that be Joe Biden?
Joe Biden decided he was going to, and one of the things he said very early was he was going to cut the distribution to Texas and Florida specifically by 50%.
I wonder why he picked on those two states.
So, you know, we were seeing tremendous success. This was a tremendous tool in our fight. And again, I don't use the word cure on any of these things. There's therapies that are effective, but this was a game changer for many people as an effective tool. There were other monoclonal antibodies that were effective as well. But it wasn't much longer after that we were told through government agencies that the Regeneron and the other one that was out are no longer effective against the Omicron.
Right, that's what they said. And there were people that I knew that were older, like our prayer department. Like the lady was over the prayer department. She tried to go and get them. She's in her 70s. And they're not available.
It was based on a modeling study. Pulliam and colleagues did it out of South Africa. And based on theoretical modeling, they said, well, Regeneron may not hit the Omicron variant. We already had sotorivimab, which was the GSK product that was EUA approved in May of 2020, specifically for resistant strains. And so the supply chain should have been established if there was any thought there was going to be resistance. Now we actually have Lilly re-entry product, which is bortezomib. These drugs are safe and effective. I completely agree with Dr. Bartlett. I saw patients in my office yesterday. They were clearly saved by monoclonal antibodies. And sadly, I heard about cases that didn't make it because they didn't get timely monoclonal antibodies. They don't stand alone as products. We use them in combination with other products. Right. But people need to understand the government response in terms of innovation was not all bad. I think the monoclonal antibodies are clearly winners. And what's happened is Americans have lost their trust, and shutting off the supply chain of monoclonal antibodies. I was on Hannity Radio. I told Sean, I said, right in the Omicron, I said, we're at the Battle of the Bulge, and we're out of ammo.
Yeah. So can we get them back? Is it possible?
Well, he took over the distribution, and thus now we have a shortage. And so, you know, my personal opinion is we did not have a shortage until he took over the distribution. I hope he doesn't take over distribution of food or other things, because he needs to focus on other things.
Well,
but we don't need him helping us with
distribution. And the gas and that's another whole program.
Okay, this is my question, because I am pregnant. The other day I was in the store and I was looking at an herbal tea, and on the back it actually said, do not take if you're pregnant. And I kind of like laughed at myself because I was thinking, man, there's this huge list they give you when you're pregnant. Don't eat this, don't eat this, don't take this. I mean, drugs that people take normal, not pregnant. And so I was thinking to myself, how is it that pregnant women can almost take nothing? Small list. But when this COVID vaccine came out, they encouraged pregnant women to get it.
One of the early things that showed up was it in the Lancet is where it leaked as well, about the increased miscarriage rate in the first trimester with the vaccine.
You know, great controversy here. Remember, pregnancy and being of childbearing age not on contraception were strict exclusion from the clinical trials. Strictly, the FDA and the manufacturers said no way they should get the vaccines. So once the program came out, the CDC and the FDA, which are running the program, they just kind of said, well, pregnant women can get it anyway. And then it kept going and going. And do you know the American College of Obstetrics officially recommends that pregnant women take the vaccine with no randomized data on safety and efficacy. And in fact, there's alarming data. As Dr. Bartlett points out, a paper by Shimbaruko and colleagues in the New England Journal of Medicine had a fetal loss rate, depends on what the denominator was, ranged from 12% to 83%. There, great controversy, tons of letters to the editor. I published in Trial Site News with Ray Stricker, who runs the largest fetal loss center in the United States. Ray and I agree that COVID-19 vaccination in pregnant women is category X, meaning should not be done.
And what I want to add to that is a teaching point that you can take to all of your friends, which is the war we're in is a propaganda war. We all know from our own lives, our own life experience, that pregnant women are told not to take anything as you've experienced. It was, as an ER doctor, we pretty much gave Tylenol. That was it. In your life, you're told by your doctor, don't have a cup of wine, don't have a puff of a cigarette, definitely don't have a bite of sushi. Right? So this is alarm bells need to go off in your head. You don't need an expert to tell you anything. Alarm bells in your own head when you're hearing things that contradict your own life experience. That was the biggest glaring exception, I think, that woke up some people. The push to give pregnant women things that are common sense and all of our life experiences said has never happened. Big clue that you're a victim of propaganda.
And when that happened, you were so appalled.
Oh, my God.
I remember we talked on the phone, and you could not even believe they were pushing on pregnant women.
I told Tucker Carlson, and you saw his reaction. This was a year ago. I said, Tucker, this is a sign that something very bad is going on. This is a sign that things are off the rails when it violates your fundamental understanding of common sense in your life experiences.
And I just want to add that study that Dr. McCullough referenced, the New England Journal of Medicine, again, propaganda is the enemy, propaganda. The data showed that the miscarriage rate in first and second trimester was about 81%, the data, but the headline read that it was safe during pregnancy.
In fact,
I kid you
the
not.
director of the CDC put out a video that was on Twitter, and it had a series of double negatives. We have no reason not to believe this is not safe in pregnancy. I'll never forget that video. Historians will record what was done was basically a propagandized approach. The most important moniker we've ever heard is a needle in every arm with no exceptions, and they meant it.
And that's when all of you realized something is going on here that is very wrong and very dark and very evil. You know, I just heard about someone, a family that their daughter lost, was 9 months pregnant, went to deliver, the baby was born stillborn, and I asked, was she fully vaccinated? And she was. But they will not connect the two. Like they don't think one thing has anything to do with the other.
I have just a really quick question. What happens if one of the people are vaccinated? Like, let's say the husband's vaccinated.
Oh, that's the other question.
Before conception, and then they have sex, conceive. Will the baby be affected then?
Yeah, and what if you got one partner vaccinated and the other one not?
We simply don't know. Pfizer, in their dossier, clearly, even in the briefing booklet, said that they were concerned about that. They wanted to know about spouses, like, for instance, typically a vaccinated man and unvaccinated woman of childbearing potential. They wanted to know about that. We don't know the answers. I do want to lay concerns for the pregnant women and frame it. It's been said by the American College of Gynecology and Obstetrics that COVID-19 is a bad disease in pregnant women. And so that's the reason why you should get a vaccine. Not correct. There are now 2 papers, one by Pinellas and colleagues, Annals of Internal Medicine, showed pregnancy is a protected state. Pregnant women do better with COVID than non-pregnant women. You know, pregnant women are told that they have an immune deficiency. Pregnancy is not an immune deficient state. It is a robust state of health because the pregnant woman, God is preparing the pregnant woman to deliver the baby in a robust health
Doesn't the baby situation. pass along the stem cells if something's going on with the mom?
The baby is very hardy. That's the truth. Also, if you should need it, hydroxychloroquine has been around for 67 years at this point. FDA approved, I should say, 67 years. Derives from quinine found in tree bark, etc. Very, very safe. Absolutely safe in pregnant women, nursing mothers, etc. So there were answers even if a pregnant woman came down with COVID. So I have such a passion for telling people to recognize propaganda in real time.
Because I know moms, this is important. I've seen moms that won't get it pregnant, but they say, oh, I'm just breastfeeding now. Is there a risk involved?
Yes. Now, Harvey Risch on Fox News, I was on that session with Laura Ingraham, clearly presented the vignette of a pregnant woman, postpartum breastfeeding, takes the vaccine, and then the baby dies this hemorrhagic fetal death, and it's almost certainly passage of the spike protein.
And I've heard that story many times, by the way, that there was a nurse, this happened, and she was so distraught over her baby's death because she thought she had frozen milk for months and then was forced to get the vaccination to go back to work. And then she had enough breast milk saved, but like she thought 3 months post the shot, she'd be fine. She started nursing the baby and the baby died.
You wouldn't take an experimental drug and then breastfeed for 3 months. You wouldn't do that. It's the same principles. You be conservative, be protective of your body, be protective of the baby.
Okay,
So good.
Cindy, it's finally your turn.
Yes. Is it true that the CDC, are they withholding data that has to do with the booster, that they keep pushing these boosters saying we have to have these?
That has hit the press wires about lack of transparency from the CDC. Don't forget the CDC holds all the data. The CDC and the FDA are sponsoring the program. That's a bad thing. The FDA should be a drug safety watchdog. They should not be sponsoring a vaccine program. The CDC is supposed to be an outbreak investigation program. So we have the wrong agencies that are tasked with getting a needle in every arm, leading the program, meaning we have no safeguards. So I think the biggest thing the CDC is holding back is an analysis of the safety data. They have the vaccine adverse event reporting system that the doctors and nurses are reporting, largely, and then they have the V-Safe data, which the patients are reporting, the patient's family, and they are not analyzing that at all. Then we heard the story that they have data on the boosters, which apparently is not favorable for booster efficacy. Remember, the World Health Organization says no boosters. The WHO says no boosters because they're concerned that the vaccine successive boosters may weaken immunity, not enhance it.
So no accountability.
Oh, wow. Okay, here's my question, and this is really important. How concerned are you, doctors, about our military having the mandated vaccinations? I was going to tell you, I just got this today. In Fairfax, Virginia, 36 airmen serving active duty in the U.S. Air Force, the Air Force Reserve, and the Air National Guard filed a lawsuit in the U.S. District Court in Omaha, Nebraska, challenging the legality of President Joe Biden's COVID-19 vaccine mandate on service members in the Air Force. So there are people who are standing up. How concerned are you about it?
So I have a couple of concerns, the doctor part of me and the lawyer part of me. So the doctor part of me, myocarditis is a really big problem, especially in young men.
Right.
Okay, so and the death rate per the CDC of young people with COVID, which is the military, right, is essentially zero. So why are you giving something that's not safe and is not necessary? That's item number one. But from a national security perspective, how in the world can you give an experimental shot, and I don't care that it's been emergency authorized, this thing is less than 2 years old. How can you give your entire military an experimental shot and call yourself military ready? Right? And let's not forget that it normally takes 10 to 15 years of study before a vaccine would be approved. They have to go through mutagenicity studies, teratogenicity studies, fertility studies, birth defects, immune defects. I'm sure I'm forgetting a couple. Oncogenicity studies. None of that really happened. So yes, I'm very worried.
And who was it? I guess it was Thomas Rentz that talked about the airmen that were affected.
You know, in the Senate testimony, January 24th, Tom Rentz and co-counsel Lee Dundas presented the Department of Defense epidemiologic database. And Senator Johnson demanded the whistleblowers be disclosed. The lead whistleblower is Flight Surgeon Teresa Long.
Yeah.
And it is clear there is a multifold increase across all the disease categories, very consistent with the Pfizer data. So this is external validity across it. And there are these acute risks of blood clots, sudden death, the neurologic incapacitation. And, you know, each flight surgeon, each pilot themselves, we have invested millions of dollars in their training. They are operating equipment that is incredibly important to us and valuable, and to put our military at risk. Do you know that there's been a couple dozen COVID deaths among servicemen, largely older ones in administrative positions, and yet at the same time there's been hundreds of suicides? You know, suicide is a much bigger threat to our military than COVID ever was. COVID is a non-issue. I've had lots of communication inside the military. This is how inept they are.
Right.
Do you know they are not keeping track of who's had COVID? That's the most important checkbox. Have you had the illness or not? How are you going to decide your Delta force? I've had conversations, by the way, with the NFL, the NBA, the NHL. They're not keeping track either. The global ineptitude of organizations to not figure out who's had COVID, because if you've had COVID, you're relatively protected from anything coming forward.
Well, I know
It's
y'all have
amazing.
heard about the different airlines and pilots who have had problems once they, take off and they get into these high altitudes.
Yeah, I think there's like 4 British Airways
Why
pilots
is
that
it
died.
especially dangerous in those higher altitudes?
They're immobile. And, the U.S. Pilots Association keeps mortality data. And year by year, there's a handful of deaths, Goodness. You guessed it, in 2021, the death skyrocketed. All the pilots in all the airlines are scared to death of the vaccines because they promote blood clotting. And if you ever looked in what a cockpit looks like, they are so immobilized there for hours.
Right, yeah.
And they are a blood clot waiting to happen.
Yeah.
They're terrified. As you mentioned, by the way, all 5 branches of the military are being sued in multiple venues. Multiple. One of the cases I'm aware about is leaning forward with Matt Staver from Liberty Counsel. They are all being because our military across all the branches, all the equipment, Air Force, all the pilots, the commercial civilian pilots are at risk. And we are putting so many people in harm's way with mass
I know
vaccination.
that First Liberty, who represented Daystar, is also representing a group of Navy SEALs, because what the government is trying to do is not only force them to take the vaccine, but tell them, hey, if you don't take it, then you have to pay us back over $1 million for your treatment.
That's crazy. Yeah. What's your, let's see how many more questions we can get.
Okay, so this one is unique. It says, we are hearing about additional variants of COVID. One especially frightening is, I don't even know how to say this, hemorrhagic fever used as a bioweapon. Is this true, and are there other variants expected?
So, after 9/11, as an ER doctor, I had to do continuing medical education on what to do if someone came in the ER that was a victim of a bioweapon attack, a chemical weapon attack, even a nuclear attack. After 9/11, that was a big deal. And so there are many viruses and bacteria that we have on that list that we've known for decades that can be used as biological weapons. And there are concerns of we know there are bioweapons labs all around the world. Yeah. We know there's no smallpox in the world, in nature anymore. It's just in a few bioweapons labs. Yeah. And so if you see a outbreak of smallpox, then it's a bioweapon attack. Wow. And so we know that this has been around for decades. And there is
there could be more coming. Is that what you're saying?
Yeah, my concern is I believe there's strong evidence that this was a bioweapon attack on our people, and it affected the whole world. The way it acted in 30 years, this is a new disease that we've never had before. It doesn't act in a natural way. And it needed to be treated in novel ways with new therapies.
And what would you two say to that?
My answer to the question that they're always bringing up about variants is it's panic porn, it's fear mongering. So there's Wuhan, there was Delta, there's Omicron. It's a long Greek alphabet, and the last variant will be totalitarianism.
Ooh. Okay, Kendra.
Okay, real quick. Can the COVID vaccine cause HIV infection? There's rumors going around that there are inactive HIV subunits in the vaccine. Do you know anything about this?
I'll take that real quickly. That's a good question. And there are sequences of code in the SARS-CoV-2 virus that are homologous to HIV, meaning that, a glycoprotein, for instance, meaning there's enough there that if exposed, it could turn the HIV test positive, and we know that because it happened with a vaccine in Australia. The very first Australian vaccine. If you search, this has been heavily suppressed in the media, but if you go on one of the search engines that allows you to, it'll take you to the story where 100% of people who took the vaccine in Australia turned HIV positive. They didn't have HIV, but now they have all the stigma of being HIV positive. So it's not the HIV illness. But again, the homology is disturbing. Yes. How does this happen? How could a virus that naturally occurring pick up this code, right?
Okay, 1 minute.
Okay, recently there have been reports of organizations such as Vaxteen that are encouraging teens to get vaccinated without their parents' consent. What legal rights do parents have, and how can they fight this?
It depends upon the state you live in. There are states that have passed rules and local municipalities that have stolen away the parents' rights. So it completely depends on local law, is the short answer. It depends where you live.
How can you find out?
The best way to fight it, honestly, I hate to be dramatic, but you literally need to have your children exit the school system, because all this peer pressure and all this activity arises really around the school system. Because if your children are at home, they're not going to be exposed to that as much. They're not going to be kind of coerced by the teachers and by their peer group to do this. I don't see any other way other than exiting the school system.
Okay, quickly.
Do the doctors have a recommendation for restoring my sense of smell after testing positive for COVID?
Tincture of time. We have tried everything on this. The virus damages the nerves. There's a plexus of nerves in the upper nasopharynx. It's called the olfactory nerve, and the virus is replicating. The one thing I want to tell people, this loss of taste and smell should remind everybody that it's a nasopharyngeal infection. Please use the virucidal washes early. Dilute povidone iodine and dilute hydrogen peroxide. If people start blasting away early, you don't get so much viral replication in the nose. Yeah. My experience is that you don't get this problem if you do virucidal nasal washes. If people sit back and let this infection brew for days and then try to take pills or other systemic therapy, they're missing out on the local opportunity.
Okay, quickly, we are out of time. So if, Dr. Bartlett, someone tests positive for COVID now, say they haven't had it, what's a quick protocol?
Take it as serious as a heart attack or a rattlesnake bite. Seek treatment early. Everybody's symptoms are mild in the beginning, so don't wait till you have severe symptoms. Get treated early. You can go to many websites. You can go to budesonideworks.com, the provider tab. You can go to synergyhealthdpc.com, but seek help. If your doctor will take care of you, that's the place to start.
And so some of the things, hydroxychloroquine, ivermectin, budesonide, vitamin C, vitamin D, quercetin, selenium.
Again, risk stratification is pretty obvious. Older individuals, those with multiple medical problems, they get in trouble. We recommend virucidal nasal washes, very important, nutraceuticals and supplements, something to cover the virus, something to cover inflammation, something to cover blood clotting.
And budesonide early, because Oxford used it early. They didn't wait for respiratory symptoms. They used it early, and 90% of hospitalizations and ER visits were prevented in the STOIC trial, a randomized controlled trial by Oxford, the oldest university in the English-speaking world, with 72 Nobel Prize laureates. They might know what they're talking about.
Okay, that's all good stuff. We are out of time. I hope you found today's chat informative. I want you to remember that, again, I said this on the last show, that God has not given us a spirit of fear, but of power and of love and a sound mind. So I want you to continue to fight, to stay informed, so you can make the best decision regarding your family's health. If you've had the vaccination, keep your immune system strong. Again, we're not here to divide. We're here to present information that you probably won't hear anywhere else, and that's why we bring it to you. Somebody said, well, why don't you give the other side? I said, well, you've got every other TV station to watch what the others are saying. Exactly. This is the one place you can come and hear from doctors that are being censored. Why are they being censored? Why in the world are they willing to put everything on the line for truth? They have nothing to gain. They're not backed by any pharmaceutical. So I'm going to ask you to pray for all of these doctors and people who are standing up for freedom. Today, if you're watching, you have a need in your life. Maybe you need encouragement. That's why we're here. That's why Daystar exists. That's why that toll-free number's on the screen. I would love for you to call. We have prayer partners that are standing by. If you do happen to get a voice message, just leave your name and number. I promise you, a real person will call you back. You can go to daystar.com, click on prayer. We pray over all the prayer requests that come into Daystar. I want to thank our special guests for joining us and helping answer some of our questions. And for more from Dr. McCullough, you can visit him online at truthforhealth.org to find out more about Dr. Gold's work. Be sure to check out americasfrontlinedoctors.org. And to keep up with the latest from Dr. Bartlett, you can find information at budesonideworks.com. Thank you so much for watching. I hope this helped you today. I hope you're encouraged. I hope you know that God has not fallen off the throne on this. He's still in control of this universe and of all creation. So you be encouraged today. Also, to find this and all other uncensored COVID-related content, be sure to visit covid.daystar.com. You can find all of these shows. And I forget, I've done 30, 40, 50 shows. covid.daystar.com. You can go and find all of these interviews that I've done and find out the information that you need to have. So thank you for watching. Thank you, doctors. Thank you, ladies. Y'all will come back. Keep us updated on everything. We'll see you next time. Bye-bye for today.